Alright, my name is Sarah Hickey, RN for PACU. Orders are to transfer the patient to a surgical unit. The patient's name is Marilyn Hughes, room C640Z, 27, female. The level of care is critical. The doctor is Dr. Hickey. She's being admitted from the PAC unit to the surgical. She was admitted on October 13th, 2020 for a left mid shaft tibula-fibula fracture due to an ice fall. The admitting diagnosis was a lower leg fracture. The surgical date was October the 13th at 13:45 with an open right internal fixation. There's no past history of surgeries or medical history. The patient's husband was present for comforting. Jeff Hughes. Number is 1-800-562-36.5 if you have any questions. The patient has signed a consent. There's no DNR, no known allergies. Blood pressure is 150/90. Radial pulse is 95, strong and equal. Respiration is 21 with clear lung sounds and equal. Temperature is 99. O2 stats 98 without oxygen. Heart sounds are normal. Skin is cold and sweaty. Abdomen soft, round, and non-distended with hypo-bowel sounds in all four quadrants. No nausea, vomiting, or diarrhea. Respirations are even, unlabored, regular. No coughing or difficulty breathing. An invasive blood pressure is on the right upper arm. Pulse ox is on the right middle finger. An IV of lactate ringer solution at 75 mL per hour does not need to be changed today. It was placed at 1400 on October 13th, 2020. In the left forearm, there's no redness, swelling, leakage, infiltration, or pain at the site. The dressing is dry and intact. Patient also has an ACE splint with dressing below the left knee, clean, dry, and intact. Loose dressing. I had to loosen up the dressing because it was tight. There is some cyanosis to the left lower leg, so we're trying to increase arterial perfusion. So I lowered that leg to also help with the pain. Morphine was given at 14:15 for a pain rate of 8 on a pain scale of 0 to 10, with complaints of throbbing and burning sensation. The patient current pain rate now is a 5. No adverse effects or side effects related to the morphine. The patient is still unable to move toes and no pedal pulse to the left side. Lab values before the surgery were all normal. Hemoglobin, hemocrat, white blood cell platelets, and creatinine and PT. The orders are for the diet. Orders are a diet liquid and Avance is tolerated until reaching a regular. No weight bearing to the left leg related to post-operative fixation. Vital signs and neural checks to lower left extremity every 2 hours. Continue morphine. Sulfate 4 to 6 milligrams IV push. Q 4 hours PRN for pain. Elevate left lower extremity. Continue with IV lactose ringer solution at 75 mL per hour. Patient needs to be positioned and continent care every 2 hours PRN with a tube-man assistance. My recommendation, Dr. Hickey needs to be notified because my concern now for the patient is compartment syndrome to the left lower leg due to the pain and the symptoms of burning, throbbing, and absence of pulse and cyanosis. Ms. Hughes may require a return to surgery for flectotomy. We might ask Dr. Hickey for some new labs and testing to be done due to the sudden change in condition. We might want to also increase the frequency of the vital signs because the blood pressure is elevated as well as the temp, and he needs to be notified of those. See if Dr. Hickey would like for the patient to receive something for the elevation and the temperature and blood pressure, such as Tylenol PRN and Letato PRN, Laetalo. The patient does not have any standing orders for oxygen. If saturation drops, you might want to ask for an order for that. Changes need to be made to the patient's care plan, such as diet, patient's able to tolerate a liquid diet with no nausea and vomiting, and so we might want to change that. However, again, you want to make sure that the patient doesn't need to be changed to nothing by mouth due to the risk for a surgery again. You should also think about improving the circulation to the body, to the rest of the body, to keep from skin breakdown and keep infection control down to the right lower leg by doing some passive range of motion and even the upper extremities. Do you have any questions for me? All right.